Good afternoon, everybody. This coalition, they just don't get it, do they? They don't realise about our National Health Service, one of the very few health services in the world where the cash in your pocket does not determine the quality of your care. Our National Health Service, more popular than the BBC, more popular than the royal family. But what does Andrew Lansley and the coalition do? They throw a grenade right into the heart of healthcare in our country. An ideological attack to break up our National Health Service. A reorganisation which will turn our National Health Service into little more than a logo to be attached to buildings and services that could be provided by anybody. The focus to be shifted from patients to profit, from care to budgets, private companies like vultures waiting in the wings to make a killing from our health service. And £80 billion of taxpayers' money to be handed over to GPs who will pass the money on to KPMG or American multinationals like United Healthcare. Private companies determining what care we get. Private companies doing the commissioning on behalf of the NHS, awarding themselves the contracts, a web of deceit. And Andrew Lansley talking about liberating the National Health Service. Liberated to do what? Run up massive borrowing debts, the freedom to go bust, liberated to be bought out by private companies, the freedom to make as much money as they can from patients that pay for their care. Is that what we really want? And we all know what will happen. Private patients first. The rest of us at the back of the queue. Compassion replaced by competition. And for patients, not for our members, not for the workers, but for patients, a postcode lottery, rationing of operations, children's services at risk, care of the elderly to get worse. And I don't know about you, but I want my GP thinking about what is best for me and my family, not what's best for his budget and for his wallet. £800 billion gamble with patients' lives. And I've got a message for Nick Clegg as he's scurrying around the House of Lords trying to get small changes before the bill goes to his Liberal Democrat conference. We don't want changes, Nick. We want this bill absolutely scrapped, torn up and thrown in the rubbish bin. And the campaign that we are fighting isn't about pay, it's not about pensions, it's about what kind of health service we leave for our children. It's about protecting and passing on the rights our grandparents fought for, our welfare state, our National Health Service, a beacon to the world, the proudest achievement of our movement. And if there's money to bail out the banks, and if there's money for bankers' bonuses, and if it's all right for the richest 1,000 people in this country to increase their wealth by 30% in the last year alone, then there's money available for our health services. Nye Bevan, when he gave birth to our National Health Service in 1948, Nye said, "The National Health Service will last as long as there are people with the faith to fight for it." And to Nye Bevan, every one of us in this famous hall tonight, In unison, we say tonight, we have the faith, and now we will fight for it, whatever happens in the Lords, and now we will win and we will save our National Health Service. It is not for sale.